The 12th season of Consider This is brought to you in part by From the Top, a national program showcasing the musical talents of young people. From the Top can be heard on KVNO Classical 90.7 each Saturday at 6 p.m.
Consider This, a program of issues and information behind today's news. Once again, from the campus of the University of Nebraska at Omaha, here is your host, Kathy Wyatt.
Spring is in the air. Unfortunately, so is something else. Hi everyone, I'm Kathy Wyatt. Welcome to this week's edition of Consider This. Our topic, allergies. Here with some survival tips are Dr. Linda Ford with the Asthma and Allergy Center in Papillion and one of her patients, Tumelo Goba Goba Quapa. Welcome to both of you, and thank you so much for joining us today. We appreciate it.
Thank you for having us.
Dr. Ford, let's just start by defining allergies.
Well, allergies is a reaction that your body has to things that typically are innocuous, like pollens and mold spores, and most people they are. You inhale them and you exhale them. But for people that are born in certain families and they have that genetic predisposition, they start making the allergic antibody and having a reaction to these things.
Speaking of which, we do have a graphic that walks us through some of the facts pertaining to allergies. If you want to walk us through that, that'd be terrific.
Glad to. Well, allergies are very common, and about 36 to 40 million people have allergic diseases, mainly allergic rhinitis, or commonly called hay fever. And it typically runs in families. You're born in the right family, particularly if your mother and father both have allergies, you're a shoo-in for having it yourself. Only one parent, it's about 35% of you having an allergic disease. And then sometimes it depends upon the month you're born in and what allergens you might be sensitive to. That's some new information that just came around. So sometimes if you're born in the fall of the year, you might have more of a reaction to some of the ragweeds and some of the pollens of that time of year. Okay. And then we know that allergies is, as we talked about, is altered reactivity, because now you're allergic to these things. You're producing an allergic antibody called IgE, and that causes that reaction to occur. Whether it's talking about hay fever with nasal congestion and drainage, and your eyes, nose, and throat and ears are all itchy, or whether you're talking about asthma. That's that altered immunity, the altered reactivity. And then we have
I was pretty surprised by this one. A sneeze can actually throw droplets 6 feet in the air at 100 miles an hour. Is that true?
Well, I don't know exactly. I've never measured them. However, it does go a long way.
Okay. And we do have another graphic. Allergens can apparently occur in several different things. If you could walk us through those just so we have a heads up there.
You can certainly get, allergens can be found in food, such as peanuts are very common, or cow's milk. In the air, such as the aeroallergens, we're going to talk about trees and grasses and weeds in a little bit. And then insect bites, the stings with the honeybees and wasps, hornets, and medications. 2% of the population is always allergic to something. So whether you talk about penicillin or you're talking about another type of medication, very common. And then cosmetics and detergents, which more causes more of the reactions on the skin rather than to reactions in your nose or your airways.
Okay, and Tumi, you are plagued by some allergens. Talk to us about that.
Yes, I am. I'm allergic to peanuts. I'm allergic to different grasses. I'm allergic to animals. I'm allergic to trees. And let's see, what else am I allergic to? I think that pretty much kind of sums it up.
Okay. And you mentioned food.
Yes.
And Dr. Ford, you know, that seems to be something that we hear, especially when it comes to something like peanuts. We're hearing more and more about those types of allergies. Now, we actually put together a graphic about the myths involved with food allergies, and we wanted to walk through those. These are things that are not true in allergies. That first one is that food allergies are very common.
Well, allergies themselves are very common. Food allergies are less common than you might think. Many people say, I'm allergic to milk, or I'm allergic to something else. And they're really not having an allergic reaction, they're having just an intolerance to the milk. But you can have true allergies to certain substances. Peanut is one of the very common ones and is growing more common as the years go by.
Okay, and secondly, most people with food allergies are allergic to strawberries and tomatoes?
Well, strawberries and tomatoes are a common myth. People think that they are, but they're not very common at all.
Okay, all right. And thirdly, some people are allergic to sugar.
Oh, no.
No,
They
okay.
may get hyper, but that's not an allergic reaction.
Okay, and we referenced milk allergies being very common in adults. And
No.
no.
No, it is not.
Okay, and 5, people with food allergies are allergic to many foods?
Oh, usually it's just one.
Okay. Food allergies make people hyperactive?
No, that's that sugar thing again.
Okay. Food allergies are either lifelong or are always outgrown?
Well, we don't really know. We do know that some of the allergens, such as milk, if it starts in infancy, the kids outgrow that over time. But some of them are lifelong, such as peanuts, that will occur even into adulthood.
Okay, and finally, food allergies are not dangerous, and I think Toomey can speak to that. You actually carry, Toomey, some devices with you in the event of an emergency. Talk to us first about what happens to you that you know an emergency, you're in an emergency situation.
Okay. What happens to me is my throat pretty much will start shutting. The best sign for me is suddenly I'll start coughing and just kind of, my lungs, I can't get any air. Once I get to that point, I know I need to use a device I carry, which is called epinephrine. Epinephrine is emergency medication that I use, and this is my actual one that I carry.
Okay, and walk us through, what would somebody do here? Show us
Okay.
kind of.
I just exchange them, and this is my tester. In the event of an emergency, this gray cap comes off, and the best place to inject this would be on the thigh. The needle will go through any fabric. Once you press it hard, hold about 10 seconds, so you count up to 10, then release it. And then cap it right back, and the safety will be back on, and then call for help in that event.
And Dr. Ford, what percentage of people, I guess, carry things like she has just described on them?
I don't know the percentage. However, it's very important that you do carry it if you're a sensitive person, because even a small amount of the food can cause a reaction. It doesn't have to be even a full bite. Even having it, if you kiss someone who has been eating peanut, for instance, it can be transferred that way. So it's very, very important that you carry this. There is no treatment for peanut sensitivity at this time. However, there was just some information that came up in March at our national meetings where they've been able to desensitize children to peanut sensitivity by giving them very small bits of peanut over time. Now, this is not for you to do at home, but that may be something that we'll be able to do in the future by desensitizing people, such as Tamiko, who is allergic to peanut, when it's more described how to do it properly and safely. Right now, they're only done in very, very small numbers of people in a hospital, in that type of setting.
Okay, and thank you, Toomey, for walking us through that, because I'm sure that many folks will find themselves in a situation where they're needing to at least assist in something like that. So thank you for doing that.
Thank you.
I want to kind of transition now from food to pollen. You put together some information for us, and we appreciate that very much. We have a graphic that kind of shows the big picture of total pollen counts.
This is what happens in Omaha, Nebraska in the pollen season. And we start off here on the left side of the slide, and you can see that that's early springtime with March and April and May, and the pollen counts are increasing, and that's all tree pollen at that time. And then we drop down to June and July, where you have May and June, and then early July where the grasses start, and then the weeds start to pollinate at that time. So you're looking, and you really have these two spikes of high pollen counts, but actually for sensitivity, depending upon what you're allergic to, you may have sensitivity all summer long from the grasses, the trees, the grasses, and the weeds, it kind of looks like that you only might have only 2 spikes here, but you may have problems all summer long if you're a sensitive person.
Okay, and you spoke or referenced tree pollen. We do have a graphic for that as well.
This is from our site, and this is looking at tree pollen over the last few years. And you can see this is brought up to date. It's 2009, where we're starting to see the tree pollen already coming in. We had a little bit of decrease in the pollen this past weekend with the rain and the snow, but now that we've got the weather around 50 degrees, our pollen's coming back up again, and we're in the moderate levels, and it'll continue to be moderate too, and it'll get up into the high levels that we had before the cool weather just very shortly. So, and then it will go on with a little bit of spike up toward the end of May, and that's when the oak pollen comes into effect.
Okay, I'm glad you referenced the change in temperature and weather, because those of us who are impacted when that happens, we've been talking a lot about that lately, where we're going from the cooler temperatures to the warmer temperatures back to the cooler temperatures, and we all just want it to kind of stay steady so that we can get through the season.
And you want to enjoy it, but the problem is once you already have primed up the nose or the airway, it doesn't take a lot of pollen to continue to have the reactions. So you start off in the springtime and you get out and you do your walking, and then you're inhaling all the pollens and you start to have reactions with nasal congestion, drainage, sneezing, whatever, and then it turns cold. You think, well, I'm home free. Now I don't have any problems, but you may still continue to have problems because it doesn't take a lot of pollen once the nose is already sensitized. Once it's already inflamed, it's like priming the pump. Then it doesn't take much at all.
Okay, I'm going to ask kind of a silly question, but it needs to be asked. This time of year when those of us are suffering from allergies in that regard, common question I'm sure, how do you know it's not the cold? Because, you know, you hear people sneezing, you look at them, they're miserable. How do you know, can you know sooner rather than later if what you're dealing with is one thing or the other?
Well, viruses run in a seasonal pattern too. That's why with influenza, there's a seasonal pattern for influenza. We don't typically have that all year long. But there are some seasonal things as with viruses. There's seasonal changes with pollens. The difference is, though, is how long it lasts. For a simple cold, it's going to last about a week. You're going to feel miserable. You're going to get bad. You may have a sneeze, 1 or 2, but not a succession of sneezes that will go on 6 or 7 sneezes in a row. That's allergy. So that's one way to take care of it. They both will produce nasal congestion. They both will have secretions. If you have an infection, you may have yellow secretions. Usually with an allergy, you have very clear white secretions. With an allergy, you're also going to have itching, which you won't have with a cold. A lot of itching. You're going to have itching of your eyes, your nose, ears, throat. A lot of itching goes along with allergies.
Now, you mentioned the color in an infection being a sign of infection. What are the proper steps for somebody to do when they know they have an infection? Because some of us tend to ignore it, hope that it will go away, and others go to the doctor right away. What really should we be doing?
Well, first off, most of them are going to be viral. And so it will, the little summer colds or the spring colds that you might have, you may feel miserable, and your little decongestant will help that along, and some Tylenol or something like that for the body aches, you may even have a low-grade temp. And that will get worse for the first couple of 3 days and then slowly get better. And for in about a week, the cold runs its cycle in about a week. If it's longer than a week, then you should see your doctor, because you may have a secondary complication such as a bacterial infection, which can come on later on.
Okay, and to me, talking about seeing your doctor, Dr. Ford is of course your physician. How often, with all the allergies that you mentioned, how often do you have to go and visit her?
Well, actually with me right now, I'm on a treatment regimen to try and control my allergies. So I get shots. So I get to go to her office and be there at least half an hour once a week now.
Wow.
Tell me on some immunotherapy allergy shots to decrease her sensitivity to the pollens and molds that are outside. She has gone beyond just a simple medication now. She requires, she has no response to avoidance and very limited responses to medication, so she had to go on to immunotherapy or allergy shots.
Well, and since we're talking about treatments, and by the way, whatever you're doing is a good thing to be doing, because you seem very, very good here today.
Yes.
Like you're doing just fine. I would have never known you were trying to deal with all of that that's going on with you now. Let's talk about treatments. You sent us a list of treatments, and it starts off with avoidance. And I know you're going to walk us through them all, but we're going to spend some more time today on avoidance and antihistamines. So if we could take a look at that list of treatments, and then we could kind of walk through those for you.
Well, the first and most important is avoidance. Knowing what you're allergic to and avoiding it. That's number one.
Okay.
And then if that's not enough, then medications are helpful. And we can use antihistamines, decongestants, topical steroid sprays, saline rinses, all that to wash the saline rinses to wash the pollens and molds out of your nose, followed by the inhaled steroids to decrease inflammation, because it happens with, what happens with allergic rhinitis or hay fever is that you get inflammation of of your airway. And the best anti-inflammatory medication we have is a steroid. And these steroids do not have the complications of taking an oral steroid, so that's why they're so helpful to use on a regular basis. Okay. And then there are many different types of antihistamines to use.
Okay, and we talked a little bit about avoidance. Let's go more into the antihistamines. I know there were some specific things that you really wanted to point out with those today, so if you could walk us through that.
Well, antihistamines are different groups. We have the older generations, which we call the first generation antihistamines. They can make you quite sleepy, so you have to be careful about that. And there have been some studies, and I think we have a graphic on one of the studies looking at driving under the influence. We always worry about that with alcohol, but you can have the same problem when you are on an antihistamine, a sedating antihistamine. And if you can see that the driving under the antihistamine, under the influence of a Benadryl type product was almost as bad as under the influence of alcohol. So you have to be really careful about the sedating antihistamines. But we do have, on the next graphic, you can see that there's also problems with learning and your performance at work or your performance at school. And we know that people that have allergies have a lessened performance during their seasons anyway, because one of the reasons is because they're awake at nighttime and they're stuffy and they can't sleep as well, so they have sleep deprivation. But even that, their performance is lower than a non-allergic person. If you use a sedating antihistamine, the performance will go down even further. If you give them a non-sedating antihistamine, the performance does come up better, but not as good as a non-allergic person.
Okay, interesting. And we were talking, anybody who's had allergies knows what it's like to suffer through them. We feel bad. It's just a whole different ballgame. But you actually have some pictures of what happens to us physically. You sent those over to us, and those are kind of eye-opening. And again, I empathize with those people that are going through this now. But you sent us a set of photographs. And so if we could go to the first one now, something about a nose crease, I know is something that you're
yes, because not only do you get the misery of the allergy, you get not only do you feel bad, I call it the misery of the allergy, but you also you're doing a lot of nasal itching, because I told you that there's a lot of itching that goes on, so you do a lot of nasal scratching. And if there's allergic solute, which causes you push up on the end of your nose, and when you push up on the end of the nose, over time you will get the nasal crease across the top. So if you're going to be scratching your nose, do it very nicely and tenderly, and not a push-up. We also call that the allergic salute, when you're pushing up with your hand up the nose.
Do you know, as long as we're talking about the nose here, I do want to ask a question. There are some people who, and set the record straight for us, the more you blow your nose, the better, or the less you blow your nose, the better. What are we supposed to be doing here? Are we just
I've
supposed
never
to be
heard of that.
Dibbling, dabbing at our noses, or what's the scoop there?
Well, you're going to produce a lot of mucus, because one of the things that happens with inflammation is that you stimulate off some of those mucus secreting glands in your nose.
Okay.
So you're going to have a lot of mucus, whether you're talking about an allergy or whether you're talking about an infection. And you want to get rid of it, because it will open up, it's only blocking the airway,
Right.
and you want to get the air through.
Yeah, because a lot of us tend to just kind of sniff that right back in, and that's not good for us, and that will probably promote, unless I'm assuming,
it's just gonna go
infection
down
or
the other way.
some other bad things. And yeah, we don't need to go any more into that. I think we're good there.
Okay.
And we do have some more photographs too, to show people about the effects, if we want to put those up.
And this child here is pretty miserable because you have the allergic shiners underneath the eyes. Those are the dark circles. Many people think it's because they haven't had enough sleep, but it really is because the nose is stuffy. And when the nose gets stuffy, you have stasis of the blood flow in that area, and that causes the allergic shiners. You can also see that this child is mouth breathing, and that goes along with it too because this child is so stuffy. You can't get anything through the nose, can't get any air through the nose, and it leaves you with with the nasal, with the allergic shiners. Over the other picture, you can see allergic conjunctivitis, where you can get a lot of redness around the eye as well, because the eyes are involved with allergic rhinitis in most people.
Okay, and we have one more photograph. It's of a person's back, and if you could
Well,
walk
it's not Tamika's, but it could have been, because her skin test was just about as bad as this one. And this child has reactions to many of the aero allergens or the pollens and molds that are out in our air. And you can see it looks like little mosquito bites, and that's how we measure them and know whether they're positive or not.
Okay, and I would like to spend some time talking about the testing. There are many people who go through their lives and assume they're allergic to something. They just grin and bear it till the next season, and then it all kind of comes back around again. If someone suspects they are allergic to something, what are the proper steps that we should be taking?
Well, first off, when you see your doctor, it's going to be a good history, taking a good history from you. Knowing when it is, what time of the season it is when you're having problems, what triggers you off, what doesn't. A very good history is 80% of the diagnosis. And then with that, the doctor will have some ideas of what you might be sensitive to. And then the skin test that we just saw will confirm that the reactions that you're having. And when we're doing the skin test, we're actually looking at the allergic antibody IgE. It's in the skin, and when we prick your skin with those certain substances, and they can be pollens and mold spores, cat, dog, house dust mites. When you prick the skin to that, it will have this reaction that you just saw that will be like a little mosquito bite with a little wheal and redness. And we'll grade that reaction in a 1 to 4. And we'll be able to understand your sensitivities. Because the first treatment, as we talked about, the first treatment is avoidance. And how would you know what you're allergic to without confirming it with skin test?
And to me, you've been through all of this. Is it painful? Tell us what this is like to go through the testing for those who are watching who may be considering it now.
The testing itself is actually, it's fast. I think it's what lasts longer is the reaction after the fact when you're waiting for your back to heal up a little. But outside of that, once you are prepared for it, going in, you don't have to take your antihistamines for a few days. That way your body is as clear. I think it's, the reading is not skewed. Then doing it on your back, it looks like a lot, but the ladies do it so fast. So I think that very good at doing it, and then you just wait after that. And for me, I knew it was just a confirmation. And I didn't think the confirmation would be as bad as it was, but it was easier for me to handle. So I think it's better to actually do the testing, though.
Okay.
The worst problem is the itching, probably.
You just want to kind of find a tree bark and just get on it so it scratches your back. But
Really?
yeah.
Okay. And what are you seeing any certain age groups? Is there a certain time we should be being tested for all of this, or how does that work?
You can be skin tested at any time. We've skin tested is in the early infancy stages all the way up to adults and older people. You get skin tested when you need to be, when you want to understand and recognize what it is that's making you ill.
What kind of problems or situations do you run into for those people who do not have histories? Maybe they've been adopted, whatever the case may be. When you ask somebody for a family history, that's pretty tough to give. So how does that change your approach then in trying to figure out what's going on with them?
Well, we have one less history point that we can take into consideration, because as we said earlier in the show, is that it does run in families. You inherit it from your parents, and without that knowledge, you don't know if you're going to be an allergic person or not. But then taking the proper history and then being able to confirm it with skin testing is the appropriate way.
And I know we talked about peanuts earlier, and one of the big issues in the schools right now is obviously really watching for that in children. What's the general run-of-the-mill procedure in schools now?
Well, many schools have a peanut-free table or an area that a child could be sitting in. But in the Nebraska school systems, much different than any place else in the country, we have protocols for emergency procedures where we can treat the child who has acute asthma or anaphylaxis, which would be a severe reaction to a food. We can treat them right into the school system. Every school has epinephrine, just like Tomika showed you. Every school has that. Every school has nebulized albuterol to use for acute asthma. We're very fortunate, and we've been able to save a lot of lives having this medication right in the school system. Not only do we have the medication there, there's 3 people in every school that is trained to deliver the medication.
Okay, wonderful. And that is a requirement across the board in the state of Nebraska?
That is a mandate from the State Board of Education.
Even with the private schools?
Not with the private schools,
Okay.
but many of them have gone on and done it anyway because it's so life-saving.
Okay, wonderful. And Tumelo, in just the few minutes that we have left, you really are dealing with quite a few allergies here. What is your message to individuals out there of all age groups who are suffering from this? Because again, you seem to have a lot of them and you seem to be doing very, very well. So what would your advice be to folks?
My greatest advice would be, if you suspect it, go get tested so you know. And once you know, in everything that you do, don't take it lightly, read. Because in everything that I do, I try to make sure that, okay, fine, I'm reading, could be labels. You know, that's one of the greatest things that you have to do to avoid a lot of, situations. And, pretty much protect yourself at home. We talked about avoidance earlier on. So like for me, I have my mattresses covered. They're like certain covers you can buy to reduce dust mites, for your pillows. Try to clean up, keep yourself tidy, and that way you'll hopefully avoid a lot of things.
Great suggestions, good advice. And we do have a website for people. If you want more information on what Dr. Ford and Toomey have talked about today, if you go to this link, that will get you connected to many other places. It's asthmaandallergycenter.com. That gets you straight to Dr. Ford. Dr. Ford, Toomey, thank you both so much for joining us today. Great information. Thank you for watching, and we will see you next week.
Consider This is an issues and information program produced by UNO Television. More information and program archives can be found at unotv.unomaha.edu. If you'd like to share your comments about this show, call UNO TV at 402-554-2516 during regular business hours.
The 12th season of Consider This is brought to you in part by From the Top, a national program showcasing the musical talents of young people. From the Top can be heard on KVNO Classical 90.7 each Saturday at 6 p.m.